coming to this part of it, the section which is very important section, women today struggle with balancing career, family, and also personal life. You're doing that. You're like mastering and you're doing it really good. What advice you want to give across to them?
That's a good question. I wouldn't call it balance. Balance, according to me, would be something which is perfect in sync. So I am far from being perfect at that. I fumble, I stumble, I juggle. I would use the word juggle more for it rather than balancing. Yes, there are things which you need to prioritize. I always tell a man only works in a normal family scenario also. A man works. A woman not only works, takes care of the house, takes care of the kids, family, everything.
Emotionally
as
physically
well.
as well.
Yes.
So it's both
So,
aspects.
my day begins at 4:45 in the morning, alarm, making breakfast, making tiffin for my son. Okay, and there are entirely different breakfasts made for the two children. There are tiffin boxes, there are short snack box, and dropping my son off to school.
So this is basically your typical day?
Yes, that's how it starts. And then, coming back to my elder one, his therapies, few things, his inputs, his food, his cooking, his day-to-day things need to be taken care of, coming to the clinic, managing things, going to pick up my younger son, teaching him after he comes back from school, because like I said, he also has certain issues which need to be addressed.
So is there a twin sister of yours who's sitting here in the clinic and then you're managing all of that?
No, like I said, you will see my son. In fact, just yesterday, my elder one had a little bit of a meltdown. My car was parked outside. I didn't know where else to leave. So both my kids were there outside over here. This is like my safe place. They come
How
here.
do you manage, ma'am? Like you're taking care of them, household work, and then here also you have to look after the patients. There'll be a lot of calls also you get sometimes, right, for inquiries and everything. How do you manage it?
You know what? I don't realize that I'm doing. According to me, I'm not doing anything great. It just happens. You don't have any other choice. You have to do it. So,
and also I think there's something you enjoy. In case you enjoy what you do, you wouldn't care about time.
With the kids I really enjoy. I love spending time. You have to create time for what you like. So when I get my kids here to the clinic very often,
and you enjoy being a dentist,
so
that wouldn't hit your mind.
Exactly.
Okay, I have to give time because you're enjoying what you're doing.
And teaching is something which happens spontaneously everywhere. People learn, kids learn. It's very important that the kids also realize the efforts that we as parents put in to raise them. A Lego toy which is worth thousands, doesn't come just like that. It is the amount of effort. I am very happy that Saransh realizes the amount of physical effort that goes in earning that money, which he builds up in probably 1 hour, a Lego set. So yes, I do try to juggle. I have old parents. My dad is 78, mom is 74. So, since I have enjoyed the benefits, all the time which they have given in raising my child, and they do help me out still, it is my responsibility also to take care of
what
them.
What keeps you motivated on those difficult days, ma'am? I'm sure everyone has those. I have. Everyone across have those difficult days. Our motivation ಏನಿದೆ ma'am? Our time motivation andre who's your go-to person? Is there something which you do differently?
Saransh, my younger son, he is, I can't tell you, like I said, he is the one who held me through. So he has taught me that you always show up. No matter how scared, he also has his own fears, anxieties, but he's always there. So he has taught me how to always be there. And Krishna, my silent warrior, his fight is much bigger than anyone else. These two kids of mine, and the love that the respect, the huge amount of love that I've received from my patients also, keeps me going. See, monetarily, yes, there is one part of it, but there are patients who make pickles for me with their own hands. There is an old auntie whose denture I had made. She gets me a bottle of mango pickle, and believe me, that is one of the most priceless things which I have got. There is a guy who works in the biryani center. Him making a biryani specially for me and getting it is something which touches my heart. A card, a thank you card.
So you have these special patients which visit you
Very often,
very
often.
and then like the the feedback which they give, they are like,
It's tremendous. I have an 80-year-old auntie coming into me. She doesn't have any single teeth in her mouth. She, the ridges are absorbed, and she's too old for the implants to be placed. So she says that, I don't have any teeth left in my mouth. I just come to see you. I feel nice coming to meet you. And, you comfort
it's
me.
something like, even without, there's no teeth for smile, but she's still smiling from inside, is because she's coming and seeing.
Yes. So,
that is human touch.
Yeah. So that keeps me going. The place from where I started, the struggle, the situation where I was to where I am today, it has of course humbled me a lot. And it gives me a smile. It keeps me going. I know there is still a very long way that I have to go, but yes, I'm thankfully I have to thank God, my kids, my family, that I am in a much better space than what I was 10 years back.
Ma'am, in your journey across, I'm talking about your professional journey, has there been one patient which is unforgettable? You will be like, okay, this patient has given me a lot of problems also, and also I have enjoyed treating this patient. Was there any unforgettable incident you want to talk about?
Yeah, there have been plenty. Yeah, all my autism kids have been like that, but I wouldn't say they trouble me, but they have all been unforgettable. But yes, there are few patients. Like there is one particular patient. Now he has got his full mouth done at 3 places. Okay, I was the third person who has done it. So he has become a half year tarala was a doctor in the hale patient. Hale patient is more of a doctor than new doctor, right? So that is what has happened. So this guy has got his full mouth, fixed, prosthesis done in some place in Mumbai. Our man is not happy. Comes to Bangalore through I don't know how, goes to another big dental clinic, spends lakhs of money, okay, still not satisfied. So this whole Brahman, almost 1 year, 1.5 years. Finally, he walks into Krishansh. Circle aito, illi bandidane, okay. And so see, already probably he's not happy. He has that apprehension. He has that doubt. So nan start madak munchene, what is actually leading him is the doubt, that shanke on mind ali. Okay, is this doctor also trying to cheat me? No matter what I say, no, but he has half-baked knowledge. Google is anyway there to help. No, but this is not right. Believe me, it took me 15 days. Okay, he was first not happy. Removing his old bridge was quite a task. I was like, fine, we will remove it. I treated him like a baby, okay, like a child, explaining each step. Sometimes just working in his mouth for 5 minutes, and the other 45 minutes just spent time talking to him. But today, after our experience, but today, at the third time when we have made, he is really happy. It's been almost 3 years. Yes, he calls me regularly. Every time he comes to Bangalore, he does come to see me, and we have become the best of friends. But yes, handling that, everybody says in fact my brother calls me a psycho magnet in a lot of cases, because it's very difficult. I say it's not that, it's just that people open up to me. Probably you attract the energies, you kind of heal them. They, it's just the trauma which a person has gone through.
Now, since now with the competition around in dentistry, you see a lot of dentists available here on the corner. You go to the other side. Even I think a lot of places, even in villages, you find a lot of dentists, a small clinic and everything. With the competition around, what do you think, ma'am? Is this you thought about this kind of competition before also? You think that people now are people who are reading medical science, people who want to become a dentist today are more approachable or more open to work somewhere and then open their own dentist? And do you think that is changing, or what exactly do you think, ma'am, to that days and to today's?
See, nowadays very few people actually want to get into clinical dentistry. Okay, I'll tell you the reasons. Like you said rightly, there are a lot of dentists in every nook and corner. So in India per se, dental treatment is India is one of the countries where the quality dental treatment is at an affordable price compared to the West. Okay, in the West, you have the insurance, you have systems to safeguard the doctors. In India, you're charging less. You're giving a much better, quality of treatment. But still there are some patients who want to create trouble for the doctors, and unfortunately there is nothing to save the doctors from the patients. You're not earning in that kind of thing where you can pay compensation. People are scared, dentists are scared to practice, okay, because see, the awareness about of the patients about their rights is increasing, but the awareness of the government or the system to protect their doctors is not there. Doctors are being hit by the patients. You know that every now and then some patient dies, something happens which is not even the doctor's fault. They are just a free punching bag. So, and the payment which we receive is not much. Okay. At the same time, if they enter into, say, a medical transcription or a corporate job, or even a call center for that matter, the payment they get is much more. The risks involved are fewer. So very few dentists actually want to go into clinical practice, is what I have seen. A lot of my batchmates are not into clinical practice. They are doing a lot of things other than the clinical practice. So let me just complete. Like you said, competition, I just want to bring this into notice. See, there are thousands. You go to a grocery shop, like there is a grocery shop right next door, you will find hundreds of chocolates.
Correct.
Small chocolates. But dairy milk stands out. There is no, it may be expensive, but everybody knows it.
The brand.
So the brand you have, it's different. Okay, so you have to establish your name. And no matter who's there, it really does not matter. As long as you do your work rightfully, you do your work ethically, I can go home and have a peaceful sleep, that I have not unnecessarily done an extraction or an implant or something like that. That makes me happy. So I don't think I'm worried about any competition, being around over here. Because like I said, I don't treat the teeth. I deal with human beings. I heal the people.
Now, with your colleagues, when you spoke about, I'm sure they invite you sometime for their workshops. There would be a lot of clinics would invite you in case if there's any surgery or if there's any advice they want to take from you. Have there been any workshops you've been part of, ma'am, and want to share those experiences?
See, I do a lot of community work. I do go to a lot of schools and educating the children and their parents, because I feel that if you educate the kids about the oral health, they take care of their parents and the grandparents. So I am a part of a lot of these community programs about the oral health awareness, not just amongst the kids, and even in a lot of corporate companies where I do a oral health check. I give them an oral health talk and make them aware of simple techniques, which is really helpful in the long run. And also many of them are not even aware that a dental disease could be a symptom of something which is going on in your body. Okay, it could also be an indicator of a heart disease. How overlooking a dental problem, a gum issue for instance, can lead to even heart diseases. How a deep cavity can even cause severe infection in the entire body. So I teach the kids the correct way of maintaining the oral hygiene.
You want to talk about those few important steps, ma'am? From an early age, you want to have
definitely,
in case you can develop, or you can tell it to the audience.
Definitely. So see, the first important thing which I want to tell all parents is, please stop instilling your fear, passing on your fear of a dentist to your kids. Most often what happens is, a child suddenly gets a tooth pain in the night, and the mom and dad will be like, you should not be eating chocolates, you should not be eating chips. Come on, the child is in a lot of pain, and now then they will tell, okay fine, ಈಗ ಹೋಗೋಣ ಡಾಕ್ಟರ್ ಹತ್ರ, injection ಹಾಕ್ತಾರೆ, ನಿನ್ನ ಹಲ್ ತೆಗಿತಾರೆ. So what are you trying to tell the child? That you are getting punished because you're having tooth pain? Going to a dentist is a punishment. You're indirectly kind of tuning your child's mind that going to a dentist is a punishment. So that cycle has to break. It is not a punishment. You should tell, like how you get a fever. Okay, as soon as the sore throat starts, you take the child to the pediatrician. Similarly, as soon as the child is complaining of a sensitivity, take your child to the nearest dentist. Probably there is some deficiency which the child is having. There could be a cleaning which can basically, avoid a root canal or an extraction in the long process. So first thing, that's what I tell all parents, please break this cycle of fear and punishment. And please start imbibing in the kids the habits of brushing twice a day. For that, you guys also have to brush twice a day. Children don't learn what they hear, they learn what they see.
See, correct.
So you should brush together. Let it be like a family bonding time where all of you all brush together at night time together. Yes, kids are very small, they tend to overlook areas. So one time let them brush in the morning. Night, I know in the morning there is a mad rush, nobody has a time. So morning hours, let the kids brush. Night time, please make sure you assist them while brushing so that, they have clean mouths, they sleep clean. If you brush your teeth twice, 80% of your dental problems can be sorted. Floss. Okay, get them into drinking water. See, now in this day and age, you cannot expect the kids to be like sadhus where, they don't have any junk food, they don't have chocolates, they don't have chips. That is not possible. Let them have it, but make sure they have ample amount of water. Okay, they rinse their mouth with water. They have gargle regularly. They have a lot of fruits and vegetables, and they just get them to a dentist once in 6 months. Especially in kids, there is a condition called as bruxism where kids tend to clench their teeth at night time. That's a very common scenario which is found nowadays, not just in kids, even in adults, in the techies, especially in Bangalore, because there is so much of stress which is going on. So if you feel your child is clenching your teeth at the night time, that clearly indicates that there is some stress and anxiety which your child is going through. Please look into it. Get the child to the dentist. Okay, so stop giving the bottle to the child while sleeping, and make sure you do not give a screen to the child when you feed. Nowadays what happens, all of us are busy. The easiest way is they mash the food. Even a 6-year-old child is given an overcooked rice dal where it's mashed and given, and they just eat. They wouldn't even know what the taste of the vegetable would be. So because of that, what happens is that a lot of kids need aligners and braces nowadays than what was needed earlier, because you're not chewing. When you chew, it's like a natural exercise where your jaws develop, your muscles
Gums
develop,
become more harder.
Your muscles develop.
Yes.
So once the muscles develop, the jaws also develop. Nowadays, people don't chew. Already, there is all ready-made food which is there, processed food. On top of that, the screen time. So that really kills it. People just eat. Kids just eat. So there are a lot of problems which are arising because of that. So please keep the screen away from the kids when they are eating, so that they focus on what they are eating, how much water they are eating. Make sure they chew their food. So these are the basic tips which I want to tell. And for this, parents, you yourselves have to follow this. Until and unless you follow, you can't keep playing a chess on the phone or watching Insta reels, etc., and expect the child not to see his TV or his rhymes.
Even sugary foods also to avoid sometimes.
Yeah, in the night time you should avoid, because what happens is that throughout the day, if you eat, it is fine. You're talking, you're drinking, there is a self-cleansing action which is happening. In the night time, if you have sugary food, the one thing is the food gets stuck in between the teeth and the salivation is not there. Okay,
and you're resting in the night.
Yeah, you're resting in the night, and your mouth is a flora of a lot of bacteria. So these bacteria act on the sugar. There is acid which is produced, which acts on the calcium carbonate of the tooth, and that's when your cavities begin. So avoid having that. Brush your teeth. The last thing in the night should be to brush your teeth. And
now, moving on, as a director of Krishansh Dental Clinic, what values do you encourage in your team? I'm sure you have a wonderful team. So
yeah.
Whenever you're not around, they're taking care of everything. So what values do you encourage in your team?
First and foremost, I tell them you're dealing with human beings. Empathy, care, love and compassion. That is all that it is. Here, you cannot see, there are, money is not the criteria where a person will not be treated in Krishansh. If a person cannot even afford the treatment, anybody walking into Krishansh receives the treatment. It's not that, just because they cannot afford a root canal, I would send them off. That has never happened. So, compassion, love, care. Special needs kids are open, they are welcome with open arms. Okay, this is a safe place. This is a place of love. This is a home for all the special needs kids. This is a home for Krishna and Saransh. This is their safe place. And that is what I have told my entire team as well. That, you know, you treat the patients like your family. The clinic has to be sterilized, instruments have to be sterilized. If you cannot put that instrument in your mouth or your family's mouth, no way can you put it in the
The
patient's
hygiene
mouth.
also.
Yeah, you cannot put it in the patient's mouth. So treat them how you would treat your family. That is when the bond forms. That is when you would be
The trust builds.
a scared patient will never be healed. You can never achieve good treatment results if the patient is scared, if there is no trust.